So good morning, Chair Carr and members of Council. Thank you for the opportunity to once again provide another public health update on COVID-19. Today I will provide some information related to our surveillance data, the vaccination rollout that is beginning to occur in the province, and some work that we've done with the schools. Next slide, please. So this graph that you're looking at shows the number of new cases of COVID-19 reported per day among Halton residents over the course of the pandemic in more detail. By the end of day on December the 14th, 4,612 cases of COVID-19 had been diagnosed among Halton residents. This includes 364 active cases and 84 deaths. The 7-day rolling average peaked in April and then began to decline and remained low over the summer. And then it began to increase again in September, rising to a new all-time high last Wednesday, December the 9th, when the 7-day average reached 65.9 cases per day. We've all seen similar numbers over the last few days. In total, between September 1st and December 14th, over 3,600 new cases were reported for Halton residents, far more than the 984 cases reported for the 6-month period between March 1st and August 31st. Between September 1st and December 14th, Halton also identified over 9,000 new high-risk close contacts associated with our cases from just this wave of the pandemic alone. Since testing is much more accessible now than it was earlier in the pandemic, the number of new cases per day can't be directly compared between the second wave and the first wave, as I've noted before. Instead, the focus really should be on the slope of the 7-day rolling average. In addition, while testing is more accessible, we know that there are still many people not getting tested for various reasons. So we should assume that our case count is an underestimate of the true population spread in the community. Next slide, please. In a previous update in October, I spoke about a science brief released by the Ontario's COVID-19 Science Advisory Table. The authors of the brief recommended that when the weekly rate in an area is higher than 25 new cases per 100,000, there should be restrictions on indoor activities where it is difficult to wear masks and or in which physical distancing is difficult to maintain. In addition, people should be encouraged to work from home if possible and to leave home only for essential activities. Halton's rate has been above 25 per 100,000 since the week beginning on October the 4th. The rate in the most recent week, December 6th to 12th, was 68.8 new confirmed cases per 100,000 Halton residents. This means that for every 100,000 people living in Halton, and we have a population of over 600,000 now, about 69 of them were diagnosed with new confirmed case of COVID-19 during that week alone. This does not include any cases from previous weeks, some of which remain active and in need of healthcare resources. We've seen the weekly incidence rate double roughly once per month during wave 2. By the end of September, it was approximately 15 per 100,000. By the end of October, it was approximately 30 per 100,000. And most recently, by the end of November, it was approximately 60 per 100,000. This is a worrisome trend that points to the possibility of our weekly rate continuing to increase. Ontario's latest modelling projections released on November 26th show that the province may experience 4,000 cases per day by the end of December. If Halton continues to account for about 3% of the province's daily cases, this projection would mean that Halton's weekly rate would double yet again to 120 per 100,000 by early January. Today's dashboard will likely show 90 new cases in the past 24 hours alone. And remember, these are as a result of exposures that occurred 1 to 2 weeks ago. Next slide, please. This graph shows the number of institutional and school outbreaks active each day between April 1st, the day that the first outbreak was declared in Halton, and December 14th. In total, 74 outbreaks of COVID-19 have been declared in Halton institutions and schools since the start of the pandemic, with 52 of those outbreaks declared since September 1st. As of December 14th, there are 17 active institutional outbreaks and 3 active school outbreaks. The number of institutions with active outbreaks on a given day has continued to rise throughout the fall. This graph does not include 55 outbreaks outside of schools and institutions that have been declared since the start of the pandemic, including 44 declared since September 1st. I also want to note that out of our 18 long-term care homes in Halton, only 1 has remained untouched by COVID-19 throughout the pandemic. I think that's a stunning number. Currently, half of our long-term care homes are in outbreak. Furthermore, we have had 3 of our 4 hospitals have declared outbreaks in the past month alone. This is reflective of the degree of community spread, as it is community cases that lead to cases in healthcare institutions where there are far more infection prevention and control measures in place than many other settings in the community. Next slide, please. This slide shows a breakdown of all types of outbreaks that we have experienced in Halton, including the institutional and school outbreaks shown in the previous slide, as well as outbreaks in the community associated with sports and fitness activities, congregate settings, private social gatherings, and workplaces. In addition to the active school and institutional outbreaks seen on the previous slide, the table shows that we are also currently dealing with 9 open workplace outbreaks and 8 open congregate setting outbreaks in Halton. Next slide, please. This graph shows the proportion of new cases in each primary exposure group per month of the pandemic. The primary exposure group captures the case's most likely source of acquisition. There are 4 main ones: contact with a known case, an outbreak, travel outside Ontario, or a known link that is not yet specified. Community cases are cases who do not have a clear source of acquisition, so they are presumed to have acquired the infection through what we call broad community spread. While the outbreaks shown on the previous slide did account for 18% of our cases in October and 16% of our cases to date in November, the majority of our cases continue to not be associated with an outbreak. This means public health is having to manage many outbreaks, but also manage a large number of cases and contacts that have nothing to do with known outbreaks. Contact exposure, shown in green, remains very common, meaning the person is believed to have acquired the infection from a household contact or another close contact that they know. This accounted for 48% of cases so far in November and 34% of cases so far in December, acknowledging that this information is still pending final determination for many of our recent cases in December. There are also a significant proportion of cases in dark blue community exposure group. As mentioned, this means we cannot determine how they acquired the infection because they are not associated with a known outbreak, have no known close contacts with a known previous case, and have not traveled based on what the case tells us. Next slide, please. The number of inpatients at Halton hospitals with confirmed COVID-19 has also followed a similar pattern to cases, but we know that the occupancy of hospital beds increases with a time lag of several weeks. This reflects the delayed spread of COVID-19 infections to more vulnerable people, as well as the delay between the diagnosis of COVID-19 and the experience of severe effects that lead to hospitalization. This graph also provides a breakdown by hospital with the 3 Halton healthcare sites in Oakville, Georgetown, and Milton, as well as Joseph Brant Hospital in Burlington. The number of confirmed COVID-19 cases occupying a bed in a Halton hospital peaked for wave 1 at 26 in April, then began to decline with some days of no COVID-19 inpatients over the summer. However, as part of the second wave, we've begun to see more beds occupied by confirmed COVID-19 cases again, followed by a new peak day on December 6th when there were 43 inpatients in Halton hospitals with COVID-19. On the most recent day for which data is available, December 14th, there were 42 inpatients in Halton hospitals with confirmed COVID-19. This represents a 110% increase in the number of patients with COVID-19 in Halton hospitals over the last 4 weeks alone. Among the 42 cases currently in hospital, 10, or about a quarter, are in ICU. The presence of COVID-19 patients in the hospital and ICU shows COVID is having an impact on the healthcare system locally and leading to beds being occupied that could be used for other purposes. As a result, some hospitals in the GTA have been facing challenges in providing their usual level of care. Next slide, please. This graph shows the cumulative number of deaths among COVID-19 cases in Halton over time. Similar to hospitalizations, the number of deaths among COVID-19 cases was somewhat delayed relative to case onset, with most deaths in Wave 1 occurring in April and May following increased outbreak activity in Halton institutions. Over the summer, there were no new deaths at all, leading to the prolonged plateau at 25 deaths from July to September that you see in this graph. Unfortunately, just since the beginning of October, 59 new deaths have occurred, raising the death toll in Halton from 25 to 84. This rapid rise of our death toll since October demonstrates how spread within the community ultimately leads to infection in more vulnerable members of our community. We have already seen more deaths as this part of the second wave than we saw in the first wave, and it is likely that we will see more losses over the next few weeks. Overall, 62 of the 84 deaths have been among residents aged 80 plus, but the other 22 deaths occurred among residents aged 40 to 79, meaning younger individuals are not exempt from the risk of death associated with COVID-19. Among the recent 59 deaths, 46 were residents in the 80 plus age group, with most associated with a recurrence of institutional outbreaks and one part of a workplace outbreak. Each of these deaths represents a tragic loss for their loved ones and our community. Next slide, please. So we do have some good news to share finally. As I mentioned in my previous update, the federal government has entered into agreements with several vaccine manufacturers. As you may have read in the news, on December the 9th, Health Canada announced that the Pfizer COVID-19 vaccine met the safety, efficacy, and quality requirements for use in Canada. This vaccine will be given in 2 doses spaced out by 3 weeks. The Pfizer vaccine has specialized handling requirements, and we expect this will limit distribution of this vaccine. As other vaccine candidates move through the approval process, it is hoped that vaccines will be available more broadly during the second phase of rollout starting in April 2021. Next slide, please. This slide outlines the 7 leading vaccine candidates. Most require multiple doses at different intervals. To date, Health Canada has received submissions for authorization for 4 vaccine candidates. Next slide, please. The Province of Ontario's COVID-19 Vaccine Distribution Task Force developed a 3-part vaccination rollout plan. The task force has prioritized the following groups to receive the vaccine first: residents, employees, and essential caregivers of congregate settings providing care for seniors, healthcare workers, adults in Indigenous communities, and adult recipients of chronic home healthcare. The province will also prioritize rollout to regions with the highest rates of infection, including those in red control and gray lockdown zones. Next slide, please. This slide provides an overview of the 3 phases of the Provincial Vaccine Distribution Implementation Plan. Phase 1 is estimated to provide over 2 million doses of the vaccines to priority groups in 2 pilot sites, followed by an expansion to approximately 21 hospitals across the province. As the stock of vaccine increases, Phase 2 of the plan will expand to other priority groups such as home care patients with chronic conditions and include an expansion in vaccination sites. Phase 3 will see the vaccine widely distributed to all Ontarians. My next slide will provide some more details on Phase 1. So we'll go on to that slide. Phase 1 of the distribution plan, which begins now, will see over 2,500 healthcare workers from long-term care homes and hospitals vaccinated at 2 pilot sites, the University Health Network and the Ottawa General Hospital. A further 90,000 doses of the Pfizer vaccine are expected between December and January 2021 in 14 selected hospitals in the gray lockdown and red control zones. Recipients will be healthcare workers in long-term care, retirement homes, hospitals, and congregate settings caring for seniors. Pending Health Canada approval, Ontario expects 35,000 to 85,000 doses of the Moderna vaccine in December to January 2021. Recipients will be residents in long-term care homes, retirement homes, hospitals, and congregate settings caring for seniors in gray lockdown areas. In early 2021, provision of the Pfizer vaccine will expand and be provided to up to 21 hospital sites. Recipients will be healthcare workers, and once forward movement is authorized by Pfizer, long-term care and retirement home residents. As well, the Moderna vaccine provision sites will be expanded. Recipients will be long-term care homes, retirement homes, public health units, other congregate care settings, and remote Indigenous communities. Next slide, please. In Halton, a corporate COVID-19 vaccine task force is being established with Dr. Joanna Oda, our Associate Medical Officer of Health, and Tony Oliveri, Acting Commissioner of the Strategic Transformation Group at the region, as co-chairs. The task force will plan, implement, and monitor the delivery of immunization to Halton residents. I will update you on the precise role of Halton Region in the vaccine process as more details become available at the provincial and federal levels. While this is exciting news, even after receiving the vaccine, individuals will still need to follow public health guidance. For example, wearing a mask and maintaining physical distancing. At this time, there is insufficient evidence on the effectiveness of the vaccine to prevent asymptomatic infection and therefore reduce transmission of the virus. It is important to remember that our collective efforts remain critical at this time and throughout 2021, and we should not let our guards down. We must continue to follow public health measures, including staying home except for essential purposes, such as going to work or school, limiting close contact to those that live with you, and maintain a 2-meter distance from anyone outside your household, wearing a mask when with others outside of your household, especially indoors, avoiding all social gatherings such as play dates, birthday parties, and dinner parties with friends or family. This includes any holiday celebrations. Next slide, please. Finally, I wanted to share a success story of how we have been able to prevent and contain COVID-19 outbreaks in Halton schools. From September 4th until December 4th, we found that 405 students contracted COVID-19, which accounts for only 0.4% of the student population in Halton. In addition, only 7 outbreaks have occurred. This tells us the infection prevention and control measures in place at schools are working. Our efforts with contact tracing and case management are also working, and schools in Halton continue to be low-risk exposure settings. Next slide, please. So with that, I thank you for your time and attention today, and I'd be happy to take any questions that you may have.